Hello and welcome. I'm Dr. Ankit Parakh and I work as a consultant in Pediatric Pulmonology, Allergy and Sleep Medicine at Children's Chest Clinic, New Delhi. So in this video, we'll talk about that how do we get a better control on our child's asthma. Now, asthma is a very common problem which is seen world over in children, adolescents and adults. It leads to long-term or a chronic cough. It can lead to breathlessness, it can lead to difficulty in breathing, chest pain, wheezing. This can limit child's activity and exercise. It can disturb sleep. Children with asthma can have asthma attacks or asthma flares and sometimes require visits to doctors, emergencies and occasionally hospital admissions. So proper control of asthma is something which is desirable, which will improve the quality of life of the child and of the whole family. So what are the 4 important ways which we recommend to have a better control over your child's asthma? The first is to use your preventive inhalers regularly. Now, children with asthma have inflammation or swelling in the airways, and if you use your preventive inhaler regularly, it will keep the swelling to a very low level, and that will lead to a very good asthma control. What we see is that most patients with asthma do not take their preventive inhalers regularly, leading to a poor asthma control. You also need to know how to take your inhalers with your spacers in a proper way, and do speak to your pediatric pulmonologist or allergist about this. Now, the second important thing which we need to know is the triggers for asthma. Now, every child or adult with asthma can have different triggers for their asthma. Now, these allergens and triggers could be outdoors in the form of pollens. They could be indoors in the form of dust mites, pet dander, cockroaches and molds. In addition, there could be non-specific triggers like air pollution, using a dhupbatti, agarbatti, mosquito coil, deodorant, talcum, perfume and cigarette smoke. Now, allergy testing is a very important way to know your allergens. Most allergists or pulmonologists will perform an allergy test for a child to understand what are the allergens which are implicating in your child's asthma. Now, if you know your triggers and your allergens, then you can speak to your pulmonologist or allergist about prevention. And prevention of allergens and prevention of triggers is a very important measure which can lead to a better asthma control. The third important thing which you need to know is how to use an asthma action plan. So, asthma action plan is a written document which we provide to each and every patient, which guides them in their asthma management in day-to-day life. It tells them what preventer to be used. It also tells them what reliever medicine should be used in an emergency where the child is not doing well, what doses to be used, how it is to be used. And it also tells you that if your child is not getting better with the reliever medicine, what needs to be done, when do you need to visit a doctor, or when do you need to report to an emergency. So every child with asthma should have an asthma action plan, which are going to help parents and families to manage their child's asthma in a better way. The fourth most important preventive measure is to have regular visits with your pulmonologist or allergist. And during these visits, the doctor will examine the child. They will talk to you about how to take your inhalers with your spacers, what technique should be used, what dose to be used, do you need to taper your inhalers or increase the doses, They can also perform an allergy test to understand what are the allergens which are there. And regular follow-ups or asthma visits are extremely important for every child. So if your child is having asthma, you need to achieve a better asthma control. Do speak to your pulmonologist or allergist about this. Thank you.